Hey everyone, my name's Elise. I'm part of the academic team at Muppets, and today a couple of us have made this video to walk you through a newborn exam. It can be probably one of the more tricky examinations in pediatrics just because you really do have to be opportunistic when examining a baby. Please note that this might not be a complete examination, so please have a look at this video in conjunction with the Children's Health Apex Overview PDF. Also, we do have a Muppets 4C Apex examination document, which goes into a little bit more depth of some of the techniques and parts of the examination you're seeing today. Also, try as much as you can when on the wards to practice under supervision, because while practicing on dolls can be really good for your technique, you can't replicate being opportunistic. Okay, in saying that, let's get started. The introduction to the newborn exam is arguably one of the most important parts of the exam. It enables you to build rapport with the parents and also find out if they have any particular concerns as well. So for the purposes of this exam, let's pretend we have baby Tommy here. I'd start by introducing myself to the parents. So hi, my name's Elise and I'm one of the 4th year medical students. Could I just start by confirming baby Tommy's details? So his full name and date of birth, please. Okay, great. So today I was just hoping to do an exam of baby Tommy, which would involve me having a general look at him, testing some of his reflexes, having a look at his vital signs like blood pressure, heart rate and temperature, and also doing a general top-to-toe examination, if that's okay with you. The examination won't be painful at all for baby Tommy, and it should be relatively quick as well. But if you'd like me to stop at any time, please feel free just to let me know. And before we begin as well, have you had any concerns or particular things that you wanted me to look at when assessing baby Tommy today? So that would be the end of my introduction, and then I'd go on to undress baby Tommy, or if there's a parent or caregiver present in the room, which is best practice, I would ask them to do so. And then it's time to get started with the exam. So first of all, don't forget your hand hygiene and gloves. Easiest thing to forget. And then undressing baby before moving on to general inspection. So first of all, looking at the vitals if the baby's connected up to a monitor, or asking for them if not, making note if the baby looks well and alert, also stating that you would measure head circumference, length and weight and plotting on age-appropriate charts. Also looking around the room and commenting on any equipment present, such as phototherapy lights or any equipment connected to the baby as well. Then making note of any obvious deformities or syndromic features, and then also having a look at the skin as well for any jaundice or rashes. Then moving on to an examination of the head and the face, first of all assessing for head shape and symmetry and any soft tissue injuries, then feeling and commenting on the anterior and posterior fontanelles and feeling for any palpable sutures. In terms of the ears, having a look at symmetry and height, before moving on to the epicanthal folds of the eyes, noting the symmetry and the red eye reflex. Then assessing the neck for any webbing, which is part of Turner syndrome, before moving on to the mouth and palate, and using a tongue depressor to look at the tongue and the palate and ruling out any cleft palate. Then pressing firmly in the centre of the forehead to assess for capillary refill. Then moving on to the chest examination. First of all, inspecting the chest for any signs of respiratory distress or effort, for example, subcostal retraction. Also having a look at the face, any nasal flaring. Also having a look for nipple spacing, for example, widely spaced nipples in Noonan or Turner syndrome. Next, moving on to auscultation, start by auscultating the lung fields, both anteriorly and axillary as well, and auscultating for heart sounds. Moving along to the abdominal examination, first of all, looking for any abnormal shapes or masses, then a general soft palpation of the abdomen. before moving on to have a look at the umbilicus for any hernia or infection, and making a note of that. Then moving on to inspection of the genitals and anus. First of all, inspecting and explaining to parents what you're doing. Looking for symmetry of thigh creases, confirming patency of genitals and the anus as well. And in patients with testes, palpating to confirm for descended testes and looking for hydrocele. Then palpating the bilateral femoral pulses for any evidence of coarctation of the aorta. Before moving on to an assessment of the hips, again looking for hip symmetry, and then moving on to performing Barlow's and Ortolani's tests, which are difficult to demonstrate in this particular model. But with Barlow's manoeuvre, the examiner is grasping the infant's thigh near the hips, and with gentle posterior pressure is attempting to dislocate the femoral head from the acetabulum. There should be no motion. However, if the hip is dislocatable, a clunk may be felt as the femoral head pops out. The Ortolani manoeuvre involves abduction and gentle pressure applied to the proximal thigh. And this is attempting to relocate an already dislocated femoral head back into the acetabulum. If the joint's already dislocated, a palpable clunk will be noticed as the femoral head slides back into the acetabulum. In terms of inspecting the arms and legs, counting the fingers and toes to assess for polydactyly or any missing digits, also assessing the tone of the legs and arms, looking for symmetry, and also looking for webbing between digits as well. Then inspecting the back and spine, picking baby up and inspecting all the way down from the cervical spine all the way down to the sacral spine, looking for scoliosis, dimples, tufts of hair, moles, or any other abnormalities, and also auscultating the lung fields at the back. Then the newborn exam isn't complete without full neurological assessment of reflexes. So first of all, with the Moro reflex, which involves holding baby and dropping their head quite suddenly, and their arm should fling up. And then performing the rooting reflex by rubbing one side of the cheek and the head should turn towards that finger. In terms of the suck reflex, the baby should exhibit quite a rhythmic sucking motion when you place your finger in their mouth. The grasp reflex can be either palmar by placing your finger into their palm or plantar on their foot, and their fingers or toes should curl around your finger. The Babinski reflex involves using something with a pointed tip and running it firmly from their heel to their toe, and their toe should furl out as opposed to older children and adults whose toes should curl in. And then for the stepping reflex, holding baby up and allowing them to take stepping motions. Then to finish up the exam, we are thanking baby Tommy's parents and asking if they have any questions or concerns, explaining and documenting findings, and then redressing baby Tommy, wrapping him up, and handing him back over to the parents or putting him in the cot. Thank you for joining us for the newborn exam. Best of luck for your assessments this year, and please reach out if you have any questions or suggestions as well. Of course, any video isn't made without a team of people, so thank you to the following people for all the hard work they've put into it. And of course, don't forget to stay up to date with us on social media, on Facebook, Instagram, or now TikTok as well.